Hello everyone. This video is a continuation of previous video about scapula. In this video we are going to see about attachments and clinical anatomy of the scapula. Muscle attachments. Subscapularis. Arises from the medial 2/3 of the subscapularis fossa on the costal surface of the scapula. Supraspinatus. Arises from the medial 2/3 of the supraspinatus fossa including upper surface of the spine of the scapula. Infraspinatus. Arises from the medial 2/3 of the infraspinatus fossa, including lower surface of the spine of the scapula. Deltoid. Arises from the lower border of the crest of the spine, and from the lateral border of the acromion process. Trapezius. Inserted into the upper border of the crest of the spine of the scapula, and into the medial border of the acromion process. Serratus anterior. Inserted along the medial border of the costal surface, superior angle, root of the spine, medial border and inferior angle of the scapula. Biceps brachii. Long head. Arises from the supraglenoid tubercle. Short head. Arises from the lateral part of the tip of the coracoid process. Coracobrachialis. Arises from the medial part of the tip of the coracoid process. Pectoralis minor. Inserted into the medial border and superior surface of the coracoid process. Long head of triceps. Arises from the infraglenoid tubercle. Teres minor. Arises from the upper 2/3 of the rough strip, on the dorsal surface, along the lateral border of the scapula. Teres major. Arises from the lower 1/3 of the rough strip on the dorsal surface, along the lateral border of the scapula. Levator scapulae. Inserted along the dorsal aspect of the medial border, from the superior angle up to the root of the spine of scapula. Rhomboid minor. Inserted into the medial border's dorsal aspect, between the root of the spine and inferior angle of the scapula. Rhomboid major. Inserted into the medial border's dorsal aspect, between the root of the spine and inferior angle of the scapula. Omohyoid, inferior belly. Arises from the upper border near the suprascapular notch. Capsular attachments of the scapula. Capsule of glenohumeral joint. Fibrous capsule of the glenohumeral or shoulder joint attaches all around the margins of the glenoid cavity. Capsule of acromyoclavicular joint. Fibrous capsule of the acromyoclavicular joint attaches all around the margins of the articular facet, on the medial spect, of the acromion process of the scapula. Glenoid labrum. Glenoid labrum is a fibrocartilaginous structure, which encircles the glenoid cavity. It helps in deepening the glenoid cavity and providing static stability to the glenohumeral joint. Ligament attachment. Coracoacromial ligament. Attaches on the medial side of the tip of the acromion process of the scapula, to the lateral border of the coracoid process of the scapula. Coracohumeral ligament. Attaches to the root of the coracoid process of the scapula. Coracoclavicular ligament. Attaches to the root of the coracoid process of the scapula. Suprascapular ligament. Bridges across the suprascapular notch and converts it into a foramen which transmits the suprascapular nerve. Spinoglenoid ligament. Bridges across the spinoglenoid notch. Glenohumeral ligament. Superior glenohumeral ligament. Attaches to the anterolateral region of the supraglenoid tubercle of the scapula. Middle glenohumeral ligament. Attaches along the anterior glenoid margin of the scapula, just below the superior glenohumeral ligament. Inferior glenohumeral ligament. Attaches to the inferior 2/3 of the glenoid labrum. Winging of the scapula. Paralysis of the serratus anterior results in winging of the scapula. Sprengel's deformity is a congenital condition, characterized by a small and undescended scapula, often associated with scapular winging and scapular hypoplasia. Fractures of the scapula are most often caused by direct trauma from the back or side.